Hi everyone, I'm here with Paul Farmer and Didi Bertrand Farmer, and we're sorry that we can't be with you today, but we wanted just to share a few thoughts with you. So Paul, start off by telling us about why community health and social medicine is so important, and why it's important to integrate an understanding of these concepts into medical education.
Well, first thing I would say there are two main, I think there are two main things that every medical student and doctor or nurse or community health worker or social worker, anybody who works in the healthcare system should really understand. One is that the delivery platform that the Rwandans are building and that we're trying to build with them, it includes almost always a triangle. So there's they're doing a training in a hospital. And whether it's a district hospital or a referral hospital or a community hospital, people need hospitals when they're sick. You break your femur or have obstructed labor, go right through the list, you need hospitals. The hospitals are connected to clinics. And the majority of medical care, in most estimates, not just in Rwanda but around the world, the majority of medical care actually occurs in clinics. And in Rwanda, those happen to be usually nurse-run clinics, and that's the second part of the triangle. And the third part, which is way too often invisible to physicians and nurses and other providers, are community health workers. And so when you can make that triangle, the chances of being effective at delivering basic health services, again, whether for an emergency or cancer, or for getting your vaccinations, or for even family planning, that triangle could make it really possible. And that, in the United States, for example, the community health worker part of that triangle is very weak. When Americans these days talk about medical homes, they're still talking about clinics and hospitals. So we've got a long way to go in the United States and a lot of the countries where I've worked. And I think Rwanda has built that triangle better, and I'm sure Didi will have something to say about the community health worker part of the triangle. The other thing I think that every medical student should know is they should know about the social determinants of disease. They should know about the large-scale social forces that put some people at risk for illness, while others are spared. And social medicine over the last 150 years has been built around an understanding of risk and understanding how to mitigate risk. That's the delivery part. You can deliver things like not just vaccines or medical care, but you can also say, we know, for example, that when girls go to school, that they're protected from bad health outcomes. So social determinants, poverty, gender inequality, lack of access to education, lack of roads, every doctor and nurse, I think, should know more about that. That's what social medicine and community health, that's why they come together. And I think it's terrific. And we're sorry we're not there with you today. We're actually headed to Lesotho tonight, where we're working on that same triangle, delivery triangle.
Thanks, Paul. Didi, let's talk a little bit more about community health. In what ways do you see that Rwanda leverages the community health worker platform, or do community health workers contribute to improving healthcare?
As we all know, that the community health workers are really playing a critical role in the health system by linking community to health centers and hospitals. And as we always say, they are the health centers' eyes and ears in the community, as they do a lot of work around case identification, accompaniment for pregnant women, accompaniment for patients with chronic diseases, with HIV. They do a lot of work also around health promotion, health prevention, by, for example, identifying case of malnutrition, by being involved in community education around good way of living, around hygiene. So the community health workers, are providing really a critical, workforce, manpower to the system by being the group within which the services are decentralizing, from the health system, which can be hospital, health centers, to the people in the community. And the fact that they are neighbors, they are mothers, they are, so the people really, trust them as they live with them, and they understand the culture, all the details that can be difficult for health staff at the health centers to get through. So I think for me, within the work that we've been doing with the community health workers, the most important thing is, to find a framework where we can provide them with the support that they need to do that big job, because it's a lot of work that they've been asking, to do. When you look into the role and responsibilities that they have, it's covering a lot of things. It's mostly in the Rwandan system where the priorities are around, childhood illnesses, maternal health, all the things that they have, chronic diseases, all the things that they have to do, to keep these indicators, up in the air. So I think, support around training, around supervision, around also compensation, find a way of motivating them to do that work, because it is a lot. It is a lot. But we have to understand that the community health worker, plays a role that is really preponderant within the health system, as they are really trying to integrate all primary health care interventions with other chronic disease interventions, as the health system in Rwanda is addressing new needs, identifying new needs, and trying to address them. So we would advise that the whole system find ways of understand the work that the community health workers are doing, and because without a formal collaboration, like an understandable collaboration where their work, their roles are being understood, so that they can find their space within that channel. Because it is clear that sometimes doctors or nurses are not paying attention to the work that the community health workers are doing. They don't understand how crucial it is to their own work. So it is really important for the community health workers to be part of that team to address the needs of the community in terms of health and preventions and all of that.
Absolutely, Didi. I couldn't agree more. For my part, I would just add that we believe that every health worker, every member of the health system, be they orthopedic surgeons in private practice in Kigali, general practitioners in a district hospital, for that matter, nurses, midwives, laboratory technicians, or accountants in the hospital, need to understand these principles of community-based care, need to understand that the health system extends from a hospital all the way out into communities, and then also needs to understand these principles of social medicine or social determinants of health. The more that each one of us can be able to put ourselves in the shoes, walk in the shoes, or the non-shoes, the bare feet of people living in poverty, the more effective we'll be in helping to improve health, because we understand all those forces outside of the health system that affect our health or constrain our health. And